Happy holidays, and welcome to Community Health Heroes, where we spotlight local leaders and organizations that provide much-needed health and wellness resources and information. Our hope is for everyone in our community to strive to live healthier, happier, and longer lives. I'm your host, Leslie Snedowski. Thank you for joining us. Today on Community Health Heroes, we'll be speaking to the chair of the Psychiatry Department at LSU Health Sciences Center, Dr. Howard Osofsky. He'll talk about the current state of mental health access in our community and how to avoid getting stressed and depressed during the holidays. And speaking of the holidays, you'll probably be buying a toy or two for the children in your life or some toys to give away to charity. We'll be talking about how to make sure you're buying gifts that are safe and what you can do if a holiday toy injures a loved one in today's Community Health Heroes report. Felice Hill with United Healthcare Community and State will stop by to tell us some important information about a new Medicare Advantage dual special needs plan that provides targeted care and services to seniors with unique needs. And for today's Eat Fit NOLA cooking segment, we'll be in the kitchen with registered dietitian and nutritionist Amy Davis, who is also the education coordinator and product specialist for Swerve, a zero-calorie, all-natural sugar replacement. She's here to make a tasty and healthier version of monkey bread, a favorite Christmas morning treat. So don't go away. We'll be right back with more Community Health Heroes.
When I was 6, my mom had a stroke.
I'm Paul George. Learn the signs of a stroke fast.
F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Spot a stroke fast.
Welcome back to Community Health Heroes. Did you know seasonal affective disorder, or SAD, is a type of depression that comes and goes with the seasons, typically starting in the late fall and early winter and going away during the spring and summer? According to the National Institute of Mental Health, SAD is diagnosed 4 times more often in women than in men. It's supposed to be the most wonderful time of the year, but for many, the holidays can be stressful and depressing. With us now is Dr. Howard Osofsky, chair of the Psychiatry Department at LSU Health Sciences Center. He'll give us some guidance about how to stay cheerful during the holidays. Welcome to the show, Doctor.
Thank you very much.
And happy holidays.
Thank you.
But it's not so happy for a lot of people out there. Why do people get depressed during the holidays?
Holidays are supposed to be very festive occasions. And at times it's hard because you're not very happy with the people you're with. People can be concerned and their families are going through economic difficulty and they're not able to get gifts. And all of these things can intertwine, in addition to the fact that people may have individual reasons at this particular time of year why they're going through difficulties.
Well, let's talk about holiday stress, which is a little different than holiday depression. Why are people so stressed out during the holidays, and what kind of guidance can you give them?
As you're an adult, and you may want to spend part of the holiday with one set of relatives, part of the holiday with a spouse, their partner's set of relatives, are people all getting along together? Again, financial. Can you contribute to the festivities of the event? There can be issues if you're parents and you're worried about children's behaviors.
Yeah, I wanted to ask you about children. How could you tell if your children are stressed out by the holidays? Because that happens too.
Mm-hmm. Children of different ages will exhibit stresses in different types of ways. For example, a teenager may be pulling away from other teenagers. And they may be worried if they're going out with friends, is everything safe when they go out?
Do you think, Doctor, it's appropriate to go to your child's school and ask their teacher questions about this if you sense something's going on?
I would say the first thing is to go to the child. Talk with the children. Say, I'm just a little bit concerned. Can we talk? I want to make sure that everything's going okay. I think that is the first step rather than going to the teacher.
I know during the holidays when families get together, families and friends, they sit around a dinner table. They talk, and sometimes that they stray into national topics and politics, and which could be kind of depressing and stressful. Can you tell us what your take is about that? Would you recommend that people kind of stay away from certain topics to create a more harmonious mood at the table?
I think it would be better to stay away from it. I actually have had people coming into me talking about how depressed they are and stressed out they are this year because of the politics and their concerns about the country. I leave that up to the people, but in general, I'd say stick to the enjoyable things about the holiday.
I think that's very good advice. Let's talk about healthcare access in New Orleans when it comes to mental health. If people need help, what type of access do they have here, not only in New Orleans, but nationally?
Okay. I can say in our community, in our department, for example, one of my vice chairs is the director of the service line, the behavioral health service line at University Medical Center. Another is in the same role at Children's Hospital. We have multiple clinics. We try to reach out and be available to people. We do many programs, including programs for children who've been abused in early childhood, for children who've been exposed to violence. With adults, we have a variety of services, including the only certified program in the state for addiction psychiatry. In many areas in our country, there is such a disparity in healthcare. There are fewer resources available, especially in rural parts of the country. But the result of this, if someone's having a problem, they may have to go 2.5 or 3 hours away to get services.
But that's not the case here in New Orleans. I mean, there's a lot of access here, right? Not the case in New Orleans.
And one of the other things that we are doing is we've been able to work not only in our training programs, but in our clinical programs at an interprofessional type of care, where we work closely with clinics in other parts of the state, using a combination of on-site treatment and telepsychiatry in between visits, so that we're working with the patients who would otherwise have disparities of care and trying to provide excellent service.
So if people who are watching this kind of identify with what we're talking about and feel a little blue during the holidays, where can you advise them to go? Where do they call?
We handle a great many of patients regardless of ability to pay. It is what is called the Behavioral Sciences Center, and I would ask people to call Allison Harris at 412-1580. That's Allison Harris. She's the administrator and very good, at 412-1580, and she will try to direct them to the best possible care.
Great. Well, thank you so much for spending some time with us, especially this time of year when you're super busy. So thank you for joining us.
Well, and I thank you for everything that you're doing, and I appreciate being here.
Well, thank you. Happy holidays.
Thank you.
When we return, what to look for when buying fun and safe holiday toys for kids in our Community Health Heroes Report.
It takes less than 1 minute to find out if you may have prediabetes, and you can do it here. So what are you waiting for? Just go to the site.
Did you know the U.S. Consumer Product Safety Commission estimates 240,000 injuries and 7 deaths were associated with toys throughout the nation last year among children younger than 15 years old? In recognition of Safe Toys and Gifts Month, I went shopping for some tips on how to buy gifts that won't hurt your loved ones, plus some information on what to do if there is a holiday toy injury, all in this Community Health Heroes Report.
Jouet.
When Liz Wood was a child, this was her playroom. Wood's family has owned Le Jouet on 1700 Airline Drive in Metairie for nearly 50 years. And today, Liz focuses on selling, advertising, and marketing toys that are not only fun, but safe.
We stand behind our products, so safety-wise and quality-wise, that's our thing.
Liz said she and the sales staff guide customers, most of whom they know by name, to find something that their children will cherish.
The store is huge. We have thousands of items. The good thing is that we really help with people's choices. We walk them around. We really get excited about what we sell. I mean, it's really a fun fun job to be a toy salesperson.
And during the holidays, when so many people are buying toys for children, safety is at the top of everybody's wish list.
Anytime your child is playing, no matter what age, the toy is for, you always want to make sure that you're observing them and that you try it out yourself so that you can really make that judgment whether it's developmentally appropriate for your child.
Ochsner Pediatrician and Section Head of General Academic Pediatrics, Dr. Samira Brown, said the biggest safety hazard is when toys with small pieces get into the hands of small children who may want to put them in their mouths.
So you really want to make sure that even if you have to take something apart, say Mr. Potato Head, that ear, the eyes, the eyebrows, they may have pieces that can come off, or you may have just bought pieces that are already really small or something that comes with dice. So you always want to open it up and play with it first to make sure that it's actually going to be appropriate, because sometimes it has something in it that you're not necessarily expecting, especially if you're not the person who actually bought it. And then making sure that if it's small enough to fit into a toilet roll, that's small enough to choke on.
Le Jouet saleswoman Melanie Allen said they make sure to recommend toys to shoppers that are age and developmentally appropriate.
If they are looking at something that's for an older child and their child isn't quite that age, then we'll be more specific of why that toy might not be best for that child. Usually it has to do with maybe some parts that could injure them or that a smaller child could swallow. So there are some toys that you may look at it right away and know that it has small pieces like little Legos. But then there's also toys that you might not think of, like a Barbie with the shoes or a baby doll with a headband that can come off.
Little kids are little kids. So if it says 2+, don't buy it for a 1-year-old. Buy it for a 2-year-old or older. And just because it says 2 doesn't mean that a 3-year-old necessarily will not play with it. Toy safety is definitely a big deal.
Le Jouet specializes in selling mainstream brands like Fisher-Price, Hasbro, and Mattel, and popular European toy brands. You'll find everything from mini baby grand pianos to elaborate train sets to cute and cuddly stuffed animals in all shapes and sizes. And gift wrapping? It's always free. But when at Le Jouet, it's hard not to be bedazzled by the bicycles.
Our bike safety is huge. We sell a ton of helmets, and we do push it because the vanity is not worth, an accident.
Any riding toy, they need to have a helmet, and at all times. Even sometimes, tricycles, things like that, folks have the misconception that it's small enough that they're not really going to get a major head injury. But we really do teach them, whether it's a balance bike, a tricycle, scooters, bikes, all of that, they have to have the helmet on to ride. And you can just make it the rule right at the beginning. No helmet, no riding.
Louisiana requires that any child under the age of 12 riding a bicycle as an operator or passenger must wear a protective bicycle helmet. At Le Jouet, bike helmets cost between $40 and $60.
You always want your child to wear a helmet when they're riding a bike. An accident can happen so fast. A helmet is the number one thing that you want to buy with a bike, and encourage your child to wear it even by wearing it yourself.
When browsing the aisles to find the perfect gift for your loved one, it's important to remember that the best holiday gift you can give to your child is adult supervision.
Accidents definitely happen, right? So you want to make sure that you're prepared. So certainly you want to have the poison control number posted in case it's something that they ingested. Certainly you want to have your pediatrician's after hours number. And here at Ochsner, we have 24-hour access to our nurse triage and to our pediatricians. And we also have a pediatrician in our ER 24 hours a day. And so we would advise that when in doubt, come in and be seen. And if you feel like things are stable and you just need advice over the phone, certainly just give us a call.
Hart, what's going on?
I'm leaving.
Why? What did I do?
Not enough. The pressure's too much. I quit.
I get it. I can do better. Just please
Don't leave.
Don't let your heart quit on you. Get your uncontrolled high blood pressure to a healthy range before it's too late.
Welcome back to Community Health Heroes. Did you know there are many people out there who are considered dually eligible for both Medicaid and Medicare coverage? Are you one of them? Joining us today to discuss a new dual special needs plan that seniors might want to consider is Felice Hill, Community Outreach Marketing Manager for United Healthcare Community and State for Louisiana. Happy holidays, Felice.
Happy holidays.
Thank you for joining us.
Thank you for having me on.
I wanted to first talk about Medicare and Medicaid. Can you tell us what the difference is?
Well, Medicaid is mostly a state program and it depends on the individual's income, whereas Medicare is for individuals 65 or older or someone with a disability for at least 24 months.
But there is a segment of the population that it's called they're dually eligible to take advantage of both. Could you explain to us what that's about?
So some individuals are eligible for both Medicaid and Medicare based on their income, based on whether or not they have a disability and they're 65 years old or older, as well as have different medical conditions. We call that the special needs community.
So Felice, tell us a little about this new dual special needs plan. What kind of benefits can people get from it?
So it is a Medicare Advantage plan. People have to be eligible for both Medicaid and Medicare. Through that plan, we offer coordination of care, hospitalization, as well as prescription drugs.
With the D-SNP plan, I know there are a lot of additional benefits. Could you tell us a little about those?
Yes, we have dental coverage as well as annual eye exam. We have reduced cost to hearing aids. We do hearing exams as well. We have assist with transportation.
So hand in hand with the eye exams, I understand there is even some money that you can get towards eyewear, right?
Yes, we provide $300 towards your eyewear, whether it's a prescription eyeglasses or contact lenses.
And Felice, how about medication? Can people take advantage with medication costs?
So we do have a prescription drug plan that is a part of the dual plan. We also offer an over-the-counter catalog where individuals can order the different medications their doctor may prescribe that may not be a part of a prescription plan.
Now, I think I read millions of people can take advantage of this D-SNP. It's about 3% of the population enrolled in Medicare. In New Orleans, are you expecting a lot of people to take advantage of this?
Yes, we're hoping that a lot of people in the greater New Orleans area would take advantage of this. We've just expanded to Lafourche and Terrebonne parishes, St. John, St. James, St. Charles parishes, as well as East and West Baton Rouge.
Now, if someone has a question and think they may be eligible, how do they find the answer? Who do they call?
They can call our 1-800 number. They also can look at uhc.com.
Great. Well, thank you so much for stopping by during the holidays and telling us about this, because it'd be good news for a lot of people out there.
Thank you for having us.
When we return, we're heading to the kitchen to learn how to make monkey bread without the sugar in our Eat Fit NOLA segment with Swerve's Amy Davis. So don't go away. We'll be right back with some more community health heroes.
I'm Molly Kimball, registered dietitian and founder of Ochsner's Eat Fit NOLA. We've collaborated with more than 100 partners locally to create Eat Fit NOLA, a partnership that highlights the better for you items right there on a restaurant's menu or on grocery store shelves, making it effortless for you to dine at your favorite restaurant or shop your favorite market without ditching your otherwise healthy diet. Every month, Community Health Heroes Show, which is sponsored by the United Health Foundation, will shine a spotlight on an incredible chef to help show you how you can make smarter food choices to live a healthier, happier, and hopefully longer life. In addition to Eat Fit NOLA, you can find our partners such as Eat Fit North Shore, Eat Fit BR, Eat Fit Bayou, and coming soon, Eat Fit Acadiana in a neighborhood near you. So don't go away. Community Health Heroes will be right back.
Where are you headed?
Just gonna hang out.
If any of your buddies ever pressure you to take a drink, just tell them you promised your dad you wouldn't.
I promise. Love you too, Dad.
They really do hear you. For tips on what to say, visit underagedrinking.samhsa.gov.
Every family has their holiday traditions, and many of those revolve around holiday food. Here with us today is Amy Davis, an education coordinator and product specialist of Swerve, a zero-calorie, all-natural sugar replacement, and Eat Fit NOLA ambassador, Emily Eickhoff, to make some yummy and healthy monkey bread. Welcome to the show.
Thank you so much for having us.
Thank you. Well, I'm so excited to learn about Swerve because I actually don't know much about it.
Okay, great. So Swerve is an all-natural sugar replacement that tastes and bakes just like sugar. If you have a recipe that calls for a cup of sugar, you would just use a cup of Swerve instead. And in the blend of Swerve is 3 ingredients. The first is erythritol, which is a sugar alcohol, and that's just made by fermenting non-GMO corn. So it has a sweet taste, but no calories. It actually just passes right through you. So it's not absorbed by the body and it doesn't affect blood sugar. And then the other 2 ingredients would just be some prebiotic fibers that help our baked goods brown and caramelize just like sugar. And then the last ingredient is just natural flavor from citrus. We do not have any stevia in Swerve, so you're not going to get that bitter aftertaste.
So let's get to the main event, the monkey bread. What exactly is monkey bread and why is it such a great holiday treat?
So monkey bread is basically a sweet bread similar to a cinnamon roll or a sweet muffin or something like that. But basically it's going to be these little balls and you just, make the dough into little balls and then you pull them apart. And so it's great for a family, for a nice special holiday treat. But the first thing we're going to do is make our own buttermilk. So you can buy buttermilk from the store, but you can also make it at home if you don't have it on hand, which most people don't. But the way we're going to make buttermilk, we're just going to do a 1/4 cup of milk, and I'm going to use almond milk. This is another great way to save calories. So I'm going to do a 1/4 cup or 4 tablespoons of the almond milk, and then I'm going to add a teaspoon of apple cider vinegar, and that's what's going to make it that buttermilk. And then we are going to make the cinnamon sugar or Swerve little mix that we are going to roll the little monkey balls in. So I'm just going to pour that in there. That's 3 tablespoons of Swerve and 2 tablespoons of cinnamon.
That cinnamon already is making it smell like Christmas. Huh?
Doesn't it smell good? Wait till the maple pecan sauce. It smells amazing. So I'm just going to whisk that together so we have it ready. Okay, so the next step is going to be making our dough. So I already have all of my dry ingredients in there, so I'm just going to mix all of that together. So we have all of our dry ingredients all mixed up right now, and so the next thing we're going to do is cut in our butter. So we are going to cut it in just like you would cut in the butter for biscuits, and we have a pastry cutter and everything. So I'm just going to put some slices in there, and you can do, you just want to do it in like squares. So we got all of our butter in, and we're going to use this pastry cutter to kind of combine it all in there.
Now with Swerve, I take it you can use it in many, many, many different recipes and different meals. So I take it that's one of the reasons why I caught Eat Fit NOLA's eye, why it was such a good product to keep track of?
Yeah, I mean, we have been really great partners with Swerve for a long time. Ben, who actually developed this recipe, is a great partner. He's from Alabama, so he switches his traditional family full of butter and fat and cream and all that, and he switches it out and makes it a little more Eat Fit friendly, and using Swerve is a great replacement. We always offer it to our partners as well if they're trying to make a sauce or a cocktail, and we'll recommend them to use Swerve instead.
And you can buy this in any supermarket?
Pretty much. Around here you can find us at Whole Foods, Rouse's, Winn-Dixie, kind of your major retailers, and then we're always on Amazon too. So you can see that the butter is kind of well combined in there. It's like little crumbles. So you want it to be crumbly. So this looks good. So we're going to add our next ingredients, and that is going to be some vanilla extract.
Which is always yummy.
Oh my gosh, and it smells amazing. So we are going to add a teaspoon. So I'm going to use my little measuring spoon. And then next we're going to add our eggs. And 3 eggs is what we're going to add. So this is where, it's probably, this might be a little bit more eggs than you would add in a normal recipe, but we have that coconut flour in there and it's extremely absorbent. So we're going to add a few eggs in here.
And I forgot to ask, how many does this serve when you're all done?
It can serve about 24 to 30 people.
Wow.
Per ball, depending on how big you make them.
There goes the buttermilk you just made.
So that's the buttermilk, and that is the last ingredient for our dough. So I'm actually going to ask y'all to help me out here and make some monkey balls. Okay, so what we're going to do, we're going to take about a tablespoon's worth. So this is a tablespoon right here, but I kind of just eyeball it, and then we're going to take that and roll it in between your palms so you get a little
I guarantee mine's going to look nothing like that. That looks really pretty. It's going to take me a few to get used to that.
Yeah, so you're just going to roll it in the cinnamon sugar or the cinnamon Swerve right here, and that's how it's going to look. So kind of like a little donut hole. And then we're going to put this in our pan. Now you want to grease this pan before so that they don't stick to the pan, but you'll just spray some nonstick spray in there, and then you can just pop them in there.
So Emily and I are going to make a couple of those. Are you going to move on to the sauce? Because I hear there's some yummy sauce coming up.
So I'll get y'all rolling, and then.
And can we just grab a little, not be totally exact to the portion size?
Yeah. So, and then we're going to add our dry ingredients, which is going to be some pecans. And some brown Swerve. So brown Swerve is kind of like a brown sugar substitute, and you can make your own brown Swerve just by mixing in a tablespoon of molasses with a cup of Swerve. So it's super easy to make at home.
That does sound easy.
Yeah, so chocolate chip cookies, I mean, hello.
Yes.
Yeah, so we're melting down this butter right now. And then so we're gonna add the pecans, brown Swerve, a little bit of cinnamon. So we're also going to add a little bit of vanilla in here, just for that
I always
flavor.
love adding almond extract as well.
Oh yeah,
that always gives it a nice,
thing.
yummy almondy taste.
Yeah, and then we're also going to add some maple syrup.
Yeah, I just saw that.
Yeah,
you put that in the sauce as well?
Yes. So we're going to put this in the sauce just so it gets that nice mapley flavor, and we're just going to do about 2 tablespoons. So not too much. We're not going to contribute much sugar here. It's really just for flavor.
And I see we're using a nice healthy maple syrup as opposed to something with a lot of additives.
Right, yeah, so we want to do a clean label, you know, grade A maple syrup, something really nice and natural. Our sauce is made, so that was super quick. You just kind of melt everything down in the saucepan, and then we're going to, so this is our baked monkey bread, and we're going to add this to our serving dish. And what you're going to do, you want to let this sit for about 10 minutes before you plop it onto the dish, but you're going to put the dish on top and then flip it.
Done like a pro.
And there it is.
Oh, wow.
So this is our serving dish. So you can see it's really easy. And then we're just going to pour this on top.
If you weren't hungry before, you are now.
Oh, yeah.
How
so
amazing.
Good.
And there's no sugar in this.
Wow.
Can you believe it?
That is fantastic.
It smells like there's a lot of sugar in it.
All right.
That's beautiful.
So that's it.
What a great job. Thank you so much.
Yeah, no problem. Thanks for having me, and I can't wait to dig into this. I hope y'all will join me in trying this
I don't
monkey
think that's
bread.
going to last around here very long. But before we let you go, how can people find out more about Swerve?
Okay, so the best resource would probably be our website, which is just swervesweet.com. We have this recipe on the website as well as hundreds of other ones and just more information about Swerve. Every question you would have, we'd be happy to answer. And yeah, you can even submit your Swerve recipes on our website too.
Oh, I bet you had a lot of good ideas from people's submissions.
Oh yeah, it's fun.
And Emily, tell us a little about Fit NOLA. How can people learn more about that?
Yeah, you can find more information at eatfitnola.com. You can also download our Fit NOLA app, and it'll show you every Eat Fit restaurant based on your location, so which one is within walking distance or right down the street from you. Or you can always contact us on social media, Facebook or Instagram as well.
Oh, great. Well, thank you so much for spending some of your holiday season with us here at Community Health Heroes. It looks wonderful, and I bet we're going to get a lot of email from people saying they had very, very successful results with that recipe, which we'll be posting on our website.
Great, awesome.
We'll be right back with some more Community Health Heroes.
Hey, Hard, what's this? That's my resignation. You're resigning. Why? You've been putting me under a lot of pressure lately. That's why I'm ready to quit. Oh, I forgot. I'll do better. Please don't quit on me.
Don't let your heart quit on you. Get your uncontrolled high blood pressure to a healthy range before it's too late.
Thank you for joining us. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit NOLA restaurant, please visit our Facebook page or email us at communityhealthheroes@gmail.com. If you'd like to learn more about our guests and share segments from our show, check out our website at communityhealthheroes.org. And you can also find our show on YouTube. We hope the information we provided you on de-stressing during the holidays, how to choose safe toys for gifts, new health insurance options, and how to make a sweet and nutritious holiday treat will help you and your family live healthier, happier, and longer lives. I'm Leslie Snedowski. Happy holidays, and we'll see you in the new year for more Community Health Heroes.